All right. Welcome back, everybody. It's KASEY Wells, your 2020 write-in presidential candidate. And tonight, I want to do a response video to Bernie Sanders' Fox News town hall meeting he had on April 15th. In my previous video, I covered universal basic income, which Andrew Yang talked about on his CNN town hall meeting he had on April 14th. And tonight, I'm going to talk about universal health care, which is a topic Bernie has been talking about for many years. I can tell you one thing that both CNN and Fox News have in common is that their headquarters are both located in the Rockefeller Center, and that is one reason you'll probably never see me aired by either one of these news organizations, because I'm highly critical of the Rockefellers, but we don't have time to get into debating them tonight because we're just talking about Bernie Sanders and universal health care. So let's get into this. Let's see what Bernie has to say about universal health care.
I believe that human beings, especially in a wealthy, democratic, civilized society like our own, are entitled to certain basic rights. So let me be very clear, and I'm sure we'll discuss it later in the show, Brett. I believe that health care is a human right, not a privilege. Okay? And I believe that there is something embarrassingly wrong when the United States of America is the only major country on earth not to guarantee health care to all people.
I agree with Bernie completely on what he just said there. Not much I could add to that. So let's see what else Bernie has to say about health care.
First of all, let's be clear what we mean by Medicare for all, okay? Medicare is a government-run program for seniors, which is widely popular and quite effective. In 1965, when Lyndon Johnson passed that bill, it was called by some Republicans socialism and everything else. But you go to the average senior and you say, how do you feel about Medicare? And they will tell you that they will oppose any Republican effort to cut Medicare. And by the way, in Trump's budget, he has proposed an $845 billion cut over a 10-year period to Medicare, which seniors don't want. So to answer your question, we are not talking about government-run healthcare. The Veterans Administration, and most veterans think that that's a pretty good healthcare system. Talk to the American Legion and the VFW. They strongly defend the veterans' healthcare. That's government-run. What we are talking about is simply a single-payer insurance program, which means that you will have a card which says Medicare on it. You'll go to any doctor that you want. You'll go to any hospital that you want. And by the way, millions of people today are in networks which prevent them from doing this. So this gives you freedom of choice with regard to the doctors you go to or the hospitals you go to.
All right, so he's talking about setting up Medicare or health care as a single-payer health insurance, and the government will be the only insurance company or the insurance program that will pay or cover people's insurance for health care. I know this is going to freak a lot of people out because it's going to potentially crush insurance companies across the U.S., which is going to put a lot of people out of work potentially. And so for us to implement universal health care, we also got to figure out a way to take care of those that may be displaced from work in the process of implementing this. So we need to have some greater debate on that and maybe leave the option of people keeping their private insurance if they want, or they can sign up for universal health care if they also want, to help ease that process in some way. But that's one step we need to figure out here for sure. How are we going to do that? All right, so what's up next? All right, the next topic for debate tonight is funding universal health care. How are we going to fund universal health care? Let's see what Bernie has to say.
I think everybody everybody is in agreement that healthcare needs to be fixed in this country. The question is how. And my question to you was, it will drive up taxes to pay for healthcare, and not just the wealthy will pay for that. The middle class will also pay for it.
Very good.
So how do you justify it? And
all right, Martha, what are you not including in your discussion?
you tell me.
I will tell you. You're not going to pay any health insurance premiums.
You're going to pay one way or the other.
But look, Martha,
Pay one way or the other.
Martha.
Whether it's in your income tax or your payroll tax, you're going to pay.
Look, healthcare is not free. You never heard me suggest that we're going to magically...
You just said it was going to be free for everyone.
It's going to be free at the point of when you use it, okay? And you go to... Why are you so shocked by this?
Because someone's going to pay.
Somebody is going to pay.
Who are they? Who
Okay,
pays?
okay, one second.
Okay,
Relax. We'll be talking.
Please.
We'll get through this
It's
together.
a common question.
Okay.
We had,
Okay, all right, here
we
we
had
go.
so many email questions.
Okay.
Ask Senator Sanders how he is
Fair
going
enough,
to pay.
I got it.
It's a fair
But the first thing, let's just say hypothetically.
Okay.
You are self-employed, and you've got a husband and 2 kids, okay? Family of 4. Do you know how much that family is paying today for health care?
Tell me.
$28,000 a year.
Okay.
All right, we're spending $11,000 per person. We are saying to that family of 4, you ain't going to pay that $28,000. You're not paying any more premiums. You're not paying any more co-payments. You're not paying any more deductibles. How's that? $28,000 you're not paying. But does that mean you're not going to pay something? Of course it does. You're going to pay more in taxes.
So Bernie's saying we're going to pay more in taxes to fund this universal health care program, or single payer insurance organization is going to be funded by our taxes. I could support that if that meant taxing the 1%, or taxing big corporations in America that have been historically dodging taxes, or even legalizing marijuana and putting a sales tax on it to fund it. As long as we're not taxing the 99% and burdening the 99% any further, I would support taxes. Maybe another idea would be religious organizations or church real estate. George Carlin said we could get rid of the national debt in a single year if we just taxed religious real estate. Just an idea thrown out there. I'm not sure if we want to go about it that way, but my main suggestion would be to end the Federal Reserve System. If our government was in control of our own money supply, how are we not going to have all the money we need to fund projects for public good, like universal health care or universal basic income, or what other project we want to fund for public good? So let's get into the conclusion here. So Bernie Sanders has been one of my favorite politicians for a long time. I'm not sure if I 100% agree with his ideas on how we're going to fund universal health care or go about implementing it, but I would certainly love Bernie to be a part of my cabinet. If you all want to vote for me and Bernie doesn't get the Democratic nomination and you want to see him within the next administration, I promise I will ask Bernie to come on down and be my vice president and help me implement universal health care in a way that helps all Americans, or at least the 99%, in the greatest way we possibly can. Okay, so in the end here, my suggestion to fund universal health care and to fund universal basic income, we need to end the Federal Reserve System, put the U.S. Treasury back in charge of printing our currency, or issuing and distributing and regulating our currency. That should be the responsibility of the U.S. Treasury, not the Federal Reserve. The Federal Reserve is a private entity, a private banking cartel, a private organization that gives out as much money to whomever they want with zero transparency or congressional oversight, and that is something that has to end. They are holding us into debt slavery, and I want to free us from debt slavery. And you know, if you all out there will vote for me or help me spread the word on this, like, share, comment, perhaps even subscribe, because I'm never going to ask you for your money. I don't want your money. If you have with any of these banks you see over here, don't give me your money. All I want is your vote.